Morning, everyone. So I am Eureka Ira M. Humawi, your reporter for today's video. So my topic is all about physical disabilities. So at the end of this video, we'll be able to define physical disabilities and the different types of physical disabilities. So let's get started. So when we say about physical disabilities, what is on your mind? Kasi ang ako magud no, ang physical disabilities is dili siya normal nga pagtubo sa imong motor skills or pag-develop sa imong motor skills, but at least no kanang mostly mga naay mga disabilities like mga physical disabilities no naa sila yung mga special talent or mga gifted children. So let's define what is physical disabilities. So according to my research, physical disabilities indicates any physical limitations or disabilities that inhibit the physical function of one or more limbs of a certain person. It can be temporary or permanent. The causes of this kind of disease are various. Any person can acquire it through accident, injury, illness, post-surgery effects, and lastly, heredity. There are different types of physical disabilities and we will tackle it one by one. So let's start. The first one is the cerebral palsy. So when we talk about cerebral palsy, it is a group of disorders that impact a person's ability to move and maintain a balance. It is usually caused by abnormal brain development or brain damage that affects one's ability to control one's muscle. It is mostly common of disability present at birth. So, what are the symptoms of cerebral palsy? The symptoms of cerebral palsy vary from person to person. A person with severe cerebral palsy may need to use special equipment to walk and a lifelong care, while a person with mild cerebral palsy may walk awkwardly but may not need special assistance. So, what are the different types of cerebral palsy? We have here number one, spastic cerebral palsy. It is the most common type, and people with this usually suffer from muscle stiffness. We also have here the spastic diplegia. Muscle stiffness is mainly in the legs, in the arms less affected or not affected at all. The third one is the spastic hemiplegia. Affect only one side of one's body, the arm is more affected than the leg. And lastly, the spastic quadriplegia. It affects our limbs, the trunk, and the face. People with this cerebral palsy or this type of palsy usually cannot walk and have other developmental disabilities such as intellectual disabilities and seizures. So, cerebral palsy have a different treatment and therapy. First is the medication such as the following, like this following can mitigate safety symptoms and side effects. We also have here the equipment. The medical equipment can improve function and outcome. We also have here the surgery, such as the following may improve side effects and overall health. We also have here the therapy. Therapies for cerebral palsy includes a physical, occupational, speech language, recreational, alternative, behavioral, plain, music, and art. And lastly, we also have here the alternative treatment for cerebral palsy. It is the complementary and alternative therapies includes the animal-assisted therapy, the nutrition, the yoga, the adaptive sports, and etc. So gasto kayo siya no, gasto kayo siya nga mag-treat ta og cerebral palsy person. I have a friend. She is a nurse by profession. He has four children, and the fourth child has this cerebral palsy. It is a mother sacrifice ni kaayo no nga. Iya gyud gi-sacrifice iyang self nga wala siya nibalik og abroad tungod kay iyahag yung gitutukan iyahang fourth child which had a cerebral palsy. She is already 4 years old and he undergo different kind of surgeries and now na siya yung mga physical therapies for him to be able to walk without assistance pero karon na pa siya yung mga equipment na gamit no and he cannot barely move his hands, but fortunately karon murag makahawid na siya, makagrabs na siya sa ka-object, and hopefully nga ma-okay na gyud kaayo niya. So, let's move on to the second physical disabilities. We have here the spinal cord injury, or what we call the SCI. So, what is spinal cord injury? It indicates the damages of any part of the spinal cord or nerves at the end of the spinal cord. So, it results permanent loss of strength, sensation, and function, mobility, and feeling. So, the causes of spinal cord injury is the trauma and diseases. The next physical disabilities we have here is the amputation. The amputation is the removal of the part of all body part that is enclosed by skin. The causes of amputation are accidents, animals attack, warfare, and surgery. We also have here the spina bifida. When we talk about spina bifida, it is a birth defect that occurs when the spine and spinal cord do not form properly. It is the type of neural tube defect. The neural tube forms early in the pregnancy and closes with the 28th day after conception. Babies with spina bifida do not have such progress and will suffer from this defect in the spinal and in the bones of the spine. So, what are the different types of these physical disabilities? Number one, we have here the spina bifida occulta. It is the mildest and the most common type. Many people who have these physical disabilities do not even know until they accept the professional medical examination. This type usually does not have any obvious symptoms. We also have here the meningococele. It happens when a baby's backbone does not form normally during pregnancy. The baby is born with a gap in the bones of the spine. And lastly, we have here the myelomeningocele. It is also known as the open spina bifida. It is the most severe type. The typical symptoms listed are spinal cord is open along several vertebrae in the lower or middle back. Both membranes are in the spinal cord forming a sac, and the tissues and nerves usually are exposed, though sometimes covers the sac. The next one is the acquired brain injury. Acquired brain injuries are due to the damage that happens to the brain after birth. They can be caused through a wide range of factors, including a blow to the head, a stroke, alcohol or drugs, infection, diseases such as AIDS or cancer, or a lack of oxygen. So there are different acquired brain injury causes such as tumors, aneurysm, infections, alcohol, hypoxia or anoxia, stroke, diseases, surgery, trauma, and seizures. The next physical disabilities we have here is the cystic fibrosis or the CF. So what is CF? So CF is an inherited or genetic condition which affects the body's respiratory, digestive, and reproductive systems. It's all about in the respiratory, no? It specifically affects the mucus and the sweat glands in the body, causing mucus to be thick and sticky. In the case of the lungs, this can clog the air passages and trap bacteria, causing lung damage and recurrent infections. We also have here the epilepsy physical disabilities. So, what is epilepsy and its symptoms? Epilepsy is a neurological condition where a person has a tendency to have a recurrent seizures due to the sudden burst of electrical activity in the brain. Seizures can cause unusual movements, odd feelings, or sensation, a change in a person's behavior, or cause them to lose consciousness. I have also a classmate way back in my high school years. No, it's a girl. She suffered from the physical disabilities, epilepsy. Then, at that time, we are so very blank-minded. We don't know what the disease she have because one time we discovered that she also she was slipped onto the ground and then he began to have these seizures, what we call epilepsy, no? And we rushed him to our clinic, and then the nurse said that we have to stay calm and waited for this to reduce na daw yung iyang pagka-seizure, and then she will be go back to normal. So, at least na orient me nga, nado siya nga na ang sakit. So, again, it is an inclusive education, so welcome, bigya punta na sa ingana siya, no? But, of course, dapat tayo po siya yung medication. So we have also here a physical disability, what we call the multiple sclerosis or MS. So what is MS? It is all about in the nerve protein. It occurs when the myelin sheath or the protective tissue around nerve fibers in the body, it becomes damaged, causing random patches or scars. The scars can interfere with messages sent to the central nervous system, affecting the brain, optic nerves, and the spinal cord. We also have here the musculoskeletal injuries of physical disabilities. This is it refers to the damage of the muscular and skeletal systems. It usually due to the strenuous activities. They are the most common work-related injuries. Workers often engage in some frequent and repetitive works that require them to hold awkward postures while working and eventually cause the disease to develop. Mostly, I realized or discovered that the OFW, especially on the Arab countries, no, grabe kay sila ka-harsh sa ilahang mga OFW or mga ilahang mga yaya dito, no. So grabe ay ilahang activities or paghinlo o sa arsab sa mga babae para sa ako ng mga bugat. Imagine, so everyday nga mo nila ganabuhaton, so grabe kuan gid nga to ang mga OFW, no. Magkasakit gid sila. Mostly sa mga spine, sa ilang mga tuhod. So, we also have here the Tourette syndrome, physical disability. So, what is Tourette syndrome? So, when we talk about Tourette syndrome, it is a neurological disorder. It involves involuntary and repetitive vocalization, sounds, and movements called tics. Kasi like tics na ginatawag na mga movements nila. These tics are neurological, not behavioral, which means a person with this Tourette syndrome cannot control by themselves. Bisag sila, dili na makontrol ilang self. Vocal tics can include sniffing, throat clearing, tongue clicking, grunting, or more rarely blurting out socially unacceptable words or phrases. Even maka-curse sila na dili po nila na control. Motor tics can include eye blinking, shrugging, nose twitching, head jerking, facial expressions, touching objects or people, spinning around, imitating someone else's action, or jumping up and down. So, napod ko na kuanan sa Facebook na he is a taxi driver mo na iyang ginabidyohan yung mga pasahero kung unsay reaction sa pasahero nga siya na siya Tourette syndrome. Ang uban kagabala ka sa iyang situation kay especially the drive no murag mahadlok pud siguro sila sa ilang kaugalingon kung magkinaon sa no. Pero nakoy uban ng mga pasahero nga gina-accept nila o dili pud sila mingon nga munaog sila. Dili lang guys istoryahan ang kanang na ay Tourette syndrome the taxi driver. I think also know that you also have to be more open-minded, you accept nila kay syempre napud sila salig sa ila kay problema aguan trabaho. Marangal na trabaho. So lastly, we also have here the dwarfism physical disability. So what is dwarfism? It's very familiar to us, no? Kay makakita mo gyapon tayo nga sa atong mga palibot ng kaning mga ng mga klase ng mga tao. So when we talk about dwarfism, it is a short stature which can be caused by over 300 genetic or medical conditions. It is generally defined as the adult height of 4 feet 10 inches or even less. So the average height of someone with a dwarfism 4 feet. So what are the different types of dwarfism? We have here the disproportionate dwarfism. It is where some parts of the body are smaller while the other parts are average or above average. We also have here the proportionate dwarfism. It is where the body is averagely proportioned and all parts of the body are small to the same degree. I think this all the different types of physical disabilities, my generalization about this kind of people have these physical disabilities is that we will be we will not merely judge them by their looks, because I know these kinds of persons who have these disabilities, I know they are very talented but in a different way. So I think for this, for also for this education or the school where I will be able to teach, inclusive education is already applied. So I think we should also have this characteristic as a teacher, the empathy character of empathy, to be able to adapt and of course embrace all these children, especially children who have physical disabilities. And I think that would be all.